In Tune. Conversations on audiology and balance. An Inventis podcast.
Welcome to a new episode of In Tune, the Inventis podcast. Today's episode is entirely dedicated to the world of hearing care. But we won't just be talking about hearing aids. We'll be discussing what it really means today to practice audiology with method, scientific rigor, and something I care deeply about: genuine attention to the patient. I'm absolutely delighted to have with me today two professionals who, in my opinion, and in the opinion of most, represent some of the highest standards of clinical approach in the field of hearing care. Dr. Marina Pinatti and Dr. Francesco Pontoni from Pontoni Udito Tecnologia. Marina and Francesco, welcome to In Tune.
Thank you, Anna. It's an honor to be here.
And we are delighted to have you with us for this episode. So, Marina, you are a trained hearing aid specialist with extensive experience in pediatrics, and therefore at Pontoni, you are responsible for pediatric applications and also look after cochlear implant users. Is that correct?
Everything is correct, Anna.
Thank you, Marina. We also have Francesco here with us, who is also a hearing aid specialist. I have always seen Francesco as someone who had a very clear vision of the role of the hearing aid specialist. He is the founder of the Clarivox method, which you can explain to us later if you like, Francesco, and the author of several books on the profession of hearing aid specialist. You are also the co-author of a book that is coming out in the next few days entitled Professione audioprotesista, the hearing aid specialist profession. If you like, you can mention this upcoming release later on. You are also a member of the Technical Scientific Committee, which wrote the guidelines for hearing aid technicians. So in short, quite a lot, I would say. Well, let's get started right away and break the ice. So I'll ask you straight away, if you had to describe Pontoni Udito Tecnologia in a single word, which word would you choose?
Can I start? I would say change. And it's the first word that comes to mind instinctively. But I'd also like to explain a little why I chose this word. It risks being an obvious choice because even on a macro level, on a global level, we witness constant change. We witness wars, tariffs, artificial intelligence. We can see everything. However, to be honest, when I think about our particular situation, for example, there is one thing I always keep in mind. For years and years, every day I have received at least one phone call with a new need, a new request, a new problem that I had never encountered before. In other words, every time there is something new to deal with. So we have to sit down, stop for a few minutes, breathe, and make a decision. So I see that sometimes we are forced to deal with change. Sometimes it is a necessity. Sometimes we want to deal with it. So I would say that it is not just a word thrown out there. It is something we experience from within. I think this change is now part of our DNA. There are about 100 of us in our organization, and I see that our whole organization is very receptive.
So you embrace change rather than being overwhelmed by it.
Yes, let's say some led the way while others follow. At least we are moving alongside change. So what I'm saying is that every time there is something new, we take a decision, and I see that everyone immediately follows our lead, so we don't stand still. So in my opinion, this is the first word that comes to mind and that represents us.
Perfect. So change in Pontoni, for Pontoni, and also change in the world of hearing care.
Absolutely.
In general, all around?
Absolutely, yes.
Marina, over to you.
For me, the right word is innovation. Here too, I would say 360-degree innovation, both in terms of products, the product portfolio we offer, which covers the entire range of solutions for the hearing impaired with mild hearing loss and for the hearing impaired with profound hearing loss. Innovation in our approach, in our methods, and also in our equipment. As my colleague said, we don't just stand by and watch. But when something new comes along, we get involved, we want to understand it better, and we try to adopt it, we want to experience it firsthand and turn it into a benefit for our patients.
Absolutely. So you want to understand innovation from every angle so that you can then take advantage of it and apply it in your hearing aid centers?
Maybe even with a few stomach aches. So it's not always smooth sailing. I mean, it's not easy to deal with change. Often it comes along and we say, oh no, not another one. But after a moment, maybe we get over it and then we get back to it and we say, okay, we have to deal with this. Let's figure out how to do it.
Exactly. So always and in any case, a proactive and positive approach to what you have to face. Therefore, change and innovation. I would say that it is an extremely powerful combination, which, however, in my opinion, based on how I know you, identifies your two personalities. Because since I have known you, I have always perceived Pontoni as a company that stood out considerably within the hearing aid landscape that I am familiar with.
Well, I would say yes, but what pleases me most and what amazes me, to tell you the truth, is that change can be made by many people. That is, I can think of a change to be made in the company, but then I need to have people who follow me. The thing that makes me very proud and amazes me in some ways is how receptive our organization is. Every time we put out a communication, I see that all our colleagues are ready the next day without too many questions. They trust us, they understand, they may debate for a moment if they are not convinced, but they follow us. And in my opinion, this is what makes our team different.
But that means, Francesco, that there is also a very positive corporate climate, a tendency among people to listen and share ideas and even doubts so that they can then be addressed.
Yes, I think there's a lot of discussion, a lot of exchange of ideas. This really helps. And obviously, it's not a one-sided conversation, but a real dialogue. Then, of course, someone has to make the decisions, and maybe not everyone is convinced or happy about it. But on average, there's a single direction and everyone follows it.
Anyway, I don't know if I can say this, but every Friday we have a half-hour meeting with all our hearing aid specialists. So sometimes it's not always our managers who come up with new ideas, innovations, and points to follow, but also our colleagues themselves who suggest everything they see and hear in the world of hearing aids.
For example, I'll say one more thing about this call, which I have a lot of faith in, about how much good this little weekly update can do. It doesn't change a colleague in a single call, but over the months and years, I see my colleagues evolve thanks to that little weekly discussion with everyone. Because in the end, there are certain situations where they tell me, I resolved that patient's issue because I remember a call 8 months ago where that colleague handled it that way. And I see these situations in a very cyclical way.
So there is the opportunity to share experiences, facts, and stories very openly, which then allows others to benefit and apply everything they learn.
But even here, it's not easy. Here, perhaps more than the possibility, I push things a bit. I want people to confront each other. Then, when they enter that pattern, when they understand everything it can bring and they trust, then they start to share in a somewhat instinctive way. It's not always easy. Because maybe there are 40 of us and someone says, but maybe there's imposter syndrome. We were talking behind the scenes and maybe someone says, but I'm embarrassed to ask this question. Maybe it's stupid. My job as Marina is to push a little because in the end, it's not stupid. These are things we all experience every day and they can be a great help in my opinion.
Perfect. So I'll take home 2 words, change and innovation. Francesco, let's start from the beginning. You told me that it all began in 1989 when your father, Roberto Pontoni, decided to open a small workshop in Monfalcone. What prompted him to take this step? Did he have a certain vision or was he driven by a sense of rebellion at the time?
So, absolutely, yes. He was born in 1989, but in reality, he was born even earlier in some ways because he is one of those hearing aid specialists, I would say first generation, if you like, who had been doing this job since the late 1970s. At that time, he obviously looked at others, tried to understand what they were doing and put it into practice. Then, like many other hearing aid specialists in Italy at that time, so I would say he wasn't the only one, he began to want to understand more. He wanted to understand what could be done. Back then, there was no artificial intelligence. There wasn't the information we have today. There wasn't all the equipment we have today. Let me tell you a little anecdote that in some ways was significant for me too. A few months ago, we were at a conference, he and I, when at one point he saw a colleague from his days at university and ran over to him. I thought he just wanted to say hello. But in fact, he said to him, look, I have to thank you. It's been 35 years, but I have to thank you because you taught me how to use snails in a course, how to get the most out of snails, the whole world of coils. And for me, it was absolutely enlightening because I realized that there was a whole world behind it, that I shouldn't just stop at what I saw from my colleague on duty, but that there was so much more. And if we think back to that time, there weren't even any digital devices. So the hearing aid specialist's work was almost entirely focused on the coil, the depth, the ventilation, the type, etc. And that, in my opinion, was the first enlightening moment for him, seeing it from the outside. So at a certain point, he said, "It's not enough for me to work like this. My father definitely has two sides to him, one entrepreneurial, but that came out later, not at that moment, and one technical. There was the technician, there was the desire to put the patient at the center."
And in fact, this is precisely what I want to get at, because I was wondering what made Pontoni stand out from other centers. Perhaps it was your father's desire to say, it's not just about technology, let's look at the patient in a different way.
Let's say that there has been a long evolution where at the beginning it may have been similar to many other centers. Then year after year, we began to create a real identity, I would say. What Roberto conveyed and continues to convey today is the importance of putting the patient at the center. I think we are a patient-centric organization, if you can call it that, but the classic example I see in certain hearing aid specialists around Italy when I speak at various conferences, for example, is that every Christmas Eve, someone calls him because they need assistance. He takes his car and goes to help him on Christmas Eve so that he can have a good Christmas. It happens and will always happen. And he has passed this on to everyone precisely by example. So in my opinion, this is also in the company's DNA, because there is this example where he could easily sit behind a desk. Instead, he is with the patients. He is 67 years old. He is with the patients all day. He does not sit behind a desk. Today, perhaps more than before. Today, he tells me more often, "I'm a bit tired." He takes a few more holidays as he should, but he is 100% with the patients. Last Friday, he said to me, "Please, let's see a patient together. I want to understand 2 new methods." And he's 67 years old. So one might say go into retirement, which he officially is, stay at home and relax. Instead, he's still asking himself these questions. He's trying to understand how to raise the bar even higher and satisfy his patients. That's the basic idea, let's say.
Yes, an idea that you then adopted and essentially communicated to everyone. And all the employees essentially embraced it?
Yes. That's the idea. Then the identity grows, you do a lot of things and so on, but the idea, the beating heart is that.
This brings us to 2017, because Clarivox was founded in 2017. I would like you to tell me something about this method. So I ask you, what changed at that point? It was no longer a question of fitting hearing aids, but of building a real method, a real rehabilitation pathway centered on the patient, which we have been talking about until now as the beating heart of your work.
Of course, at that moment, we didn't understand the magnitude of this project when we started it. We understand it today at the end of 2025. Today, we understand that it was a milestone in our journey, I would say. In reality, it didn't start in 2017 because Marina and I joined our company in 2007, if I remember correctly. And at that time, above all, but we still do it now, there was curiosity, there was a desire to understand, and above all, there was a desire to learn more. I remember Saturday mornings, Marina and I in Monfalcone, where my father, Roberto, would bring us patients and tell us to try out the latest technologies to see what we could do with them. So we took this desire to raise the bar with us. I hear myself saying, among other things, that over the years we have asked ourselves a question: why does Roberto, for example, have extremely satisfied patients while other hearing aid specialists have fewer? There was satisfaction, but less so. So we went to see for ourselves, we asked ourselves questions, and when we asked the hearing aid specialists naively, I hear myself say, they all replied, "It's experience, I do this because experience tells me that this is the right thing to do." In reality, I'm not saying that experience doesn't exist, but experience is simply a series of mental patterns. Where a person has encountered that situation several times over the years, they have tried many solutions over the years and subconsciously know that there are 3, 4, 5 things that can be done. What we have tried to do, myself in particular, is to first of all extrapolate all the situations that the hearing aid specialist encounters during the course of their rehabilitation, all the possible situations and various problems.
So you did a screening of the problems that a hearing care professional might face.
Then I extrapolated all the best practices. So which ones are the best? Actually, all of them. from the best to the simplest, but ones that can help in those situations. And then, which is very important within Clarivox, I also tried to give them a sort of priority because each situation can be more or less important and impactful than others. Let me give you a very simple example. If we get the expectation wrong during the visit, this is something that hearing aid specialists know. If a hearing aid specialist slips up and says, you'll hear well in restaurants, even very noisy ones, and then we do a fantastic job, we perform a miracle, we make them feel really good, but in the restaurant, this person doesn't feel it. This person will always be dissatisfied. So that problem has a very, very strong impact on the process. On the contrary, if we make a mistake, we increase the high frequencies by 2 decibels. The person comes back the next day saying, it seems a little high to me. We put the previous fitting back on and the problem is solved. So it is obvious that there are many actions and they have different importance, priority, and impact. This is without going into extreme detail, but this is kind of the heart of Clarivox. So trying to understand what the priorities are, which ones have the most impact, what solutions an audiologist may face, and what the possible solutions may be. So we provided them with a mental model to think about.
Okay, thank you.
That's pretty much the concept.
This is for the hearing aid specialist. So when a patient walks into a Pontoni clinic, what kind of experience can they expect?
So here I can address several aspects, technical aspects perhaps. Then I'll let Marina speak a little more. One thing that many centers do, but the idea is definitely to provide a course of acoustic rehabilitation. It's not a case of I'll fit the hearing aids and you can call me if you need anything. We are absolutely nowhere near that kind of situation. So we want to take them by the hand and guide them to the best possible outcome, the best possible result. Then there is a whole area which, in my opinion, is still important in terms of experience. I would say that for the patient, we do not do anything extremely different from others, but I think we do an infinite number of small micro details which in the end all add up and make the difference. I'll mention just a few. The welcome letter, the thank you letter. When a person entrusts themselves to us, written by me, Roberto, and my brother Matteo, just to help them understand the world they have entered, the path we should take. They all have a logbook that accompanies them during their acoustic rehabilitation journey. But other details, for example, that came about a bit by chance, were not planned. Roberto has been passionate about writing for quite a few years now and has written several books. I don't know how many there are, I think 6 or 7, perhaps 8.
I saw them on display the last time I visited you.
However, we do not aim to make money from those books. On the contrary, they represent a cost for us. So we have decided to print them and give them to our patients free of charge. Obviously, not all of them are readers, but I can assure you that if you come to one of our waiting rooms, you will find patients reading that book and then asking, Kalani, can I take it home? So much so that they come back and say, can I have the new one? So much so that every now and then people come into the clinic who have no hearing problems, they have nothing. That is, they are not interested in being there for a hearing test, but maybe they are neighbors. They have talked about it and they say to me, I've read a book, can I have another one? So this thing brings all the patients into our ecosystem, into our way of thinking, so to speak, and there are countless other small details like this.
So many little things that, taken together, have made a difference over the years.
They gave us an identity where I would like to emphasize something Marina said earlier. Perhaps in some ways for the first user, it may even be normal, because they arrive in this world and find themselves catapulted there. Users who come from other situations, on the other hand, are a little shocked because they say, before I was managed differently, I had to call, I had to press to get my devices checked. I'm not saying I was treated badly, but we hear a bit of everything. You can imagine in this world, while they find a whole other kind of experience. These are the ones who give us the most satisfaction because they tell us so, they tell us about it, they bring us gifts every day. We have our WhatsApp group with everyone, gifts all the time, from chicken eggs to cakes, everything, absolutely everything. And this is obviously a sign that our way of doing things is appreciated.
Absolutely. Marina, now I would like to understand how what Francesco has told us translates into practice in terms of technique. So, where does the work of hearing aid specialist Pontoni begin? Because we have always talked to you about REM measurements, speech intelligibility index, speech mapping, and 360-degree speech mapping. So now I would like us to pause for a moment on all these things I have mentioned to hear your opinion and how you apply it all in your daily practice.
Thank you, Anna. That's a great topic to discuss and a very broad one at that. When I try to convey these concepts to my colleagues, I always remind them that we are healthcare professionals, and as such, we have an obligation to treat our patients in the most appropriate manner. To do this, it is not enough to listen to the patient, which is a fundamental part, but we must also be able to understand what we are doing at that moment for our patient. And depending on where our patient is, we have corrective measures to apply. We can apply these corrective measures using subjective methods, but also objective methods. There is no dividing line between the two, but the two must always coincide and lead us to provide the right solution for the patient. But if I do not know what I am giving them at that moment, how can I expect my patient to have a certain result? This is why, through REM, which are objective measurements taken at the tympanic level of the amount of gain we are giving our patient, this data is essential to understand whether or not I am giving them the opportunity to access the correct language and signal for listening to speech and conversation.
So are you a fan of REM measurements, real ear measurements?
I like to know what's happening in my patient's ear, because I need to understand what's going on there. How the patient then processes that information is something other professionals can address, but at the very least, I need to make sure my patient has access to speech.
And in your opinion, why aren't REMs adopted by many hearing care professionals? Because I've been told that they take a lot of time. Maybe they're difficult. Sometimes maybe there's just a lack of willingness to try or a difficulty that can actually be easily overcome. Since you really embrace this philosophy, how do you see this situation? Why are they set aside?
Well, I've thought about it many times, and I think it partly stems from my university training. University is very theoretical, but the practical side is too often left to internships. So if an audiologist is lucky enough to do an internship in a diligent company that follows protocols, they learn. If a colleague does an internship in a company where this method is not used, this method remains a theory, and putting theory into practice, like everything else, is hard work. But once you learn it, it actually helps a lot and also streamlines the work, because often you find yourself unable to reach an agreement with the patient. We speak a language of decibels and hertz. The patient talks about sensations. I feel gloomy, I hear rumbling, I hear metallic sounds. Then, after a while, the patient may get bored, especially if they are of a certain age. And so, in my opinion, it is often misleading. What they say is very important, but how can I interpret it? I have to use a REM to understand if I am going in the right direction, because a metallic sensation does not necessarily mean that he hears too many high-pitched sounds that he is not yet used to hearing. Sometimes there is a total lack of low-pitched sounds due to wider ventilation than what was initially measured. So everything has to be evaluated and put together. As in clinical practice, one examination is not enough to reach a diagnosis. We too, in prosthetic practice, must carry out more examinations and have more tests available to us in order to give our patients the best possible care.
Okay, so in your opinion, Marina, I'd like to come back to this topic of university for a moment because I find it extremely interesting and it's also particularly close to my heart. So students learn more in practical terms what measurements are during their internship and must therefore be lucky enough to find themselves in a context where these measurements are actually applied. Do you think it would be necessary to intervene a little more at university level and consequently not relegate everything to the final part, but pay more attention during the study program?
It would certainly be beneficial for university programs to include more hands-on training so that certain minimum requirements are verified during the course of study, rather than being left to the individual initiative of students who, either by encouragement or on their own, end up acquiring these skills.
Perfect. Everything is crystal clear. You've really answered my question and cleared up an important doubt I've had for a long time. Another tool that I know you use on a daily basis is the Speech Intelligibility Index, which our Maestro software allows us to view both unaided, i.e. without a hearing aid, and aided with the hearing aid inserted and switched on. There is even a comparison between the SII before and after fitting. Could you explain to our audience what the Speech Intelligibility Index is? What does it allow you to understand? And why is it important to you?
So this is a wonderful tool that shifts prosthetic assessment from a quantitative approach, where we look at PTA, where we look at thresholds, to a qualitative approach. Because the speech intelligibility index, in simple terms, is the amount of access to speech that our patient has without hearing aids and with hearing aids. How can I expect a patient to hear and understand their family if I don't give them the right amount of speech information? In my opinion, this is the parameter that shifts the audiological factor from a question of mere quantity. I have hearing loss, but how does this hearing loss allow me to understand? Something very interesting that I read recently is that the Canadian guidelines for hearing aid fitting do not only give a minimum threshold, but also a minimum speech intelligibility index. If my patient without aids has an SII score of less than 80%, it means that my patient does not have all the information they need if they are a child to acquire speech normally, and if they are an adult to understand it easily in all situations. So here we shift the idea from I have a lack of quantity to I have a lack of information and quality to comprehend speech.
And it's a tool that you always use.
The degree of improvement is really, really very significant, in fact.
The degree of improvement, therefore a percentage value that tells you how well a patient can hear with that particular hearing aid setting. So it gives you a quantitative idea, if I can put it that way.
Exactly. It provides a parameter that, in my opinion, should always be monitored because, as I keep saying, sometimes we are limited by the patient's subjective sensations, by a very narrow dynamic range. But I need to know if I am giving them something and how much I'm giving them, especially when working with uncooperative patients. And I'm not just talking about children, but also adults with a limited attention span. So it needs to be embraced in its entirety.
And another tool that you use is live speech, particularly what you call 360-degree live speech. So the importance of evaluating the patient in their everyday living environment. Marina, what exactly is this 360-degree live speech and how do you apply it?
So before I tell you what it is, why did we come up with live speech 360 degrees? Because for years, patients would say, yes, but I can hear here when they came in for checkups. In our clinic, I can always hear well here. The problem is outside. So we started simulating cocktail party noise with computer speakers and audiometer speakers, but they would say, but outside it's completely different. When does it ever happen that our patients hear speech on one side and noise on the other outside? How often does listening happen in both directions? It doesn't exist. Listening is 360 degrees. We are always immersed in a listening environment. If we are in silence, we hear reverberation. If we are in a closed room, if we are in a bar, we hear confusion all around us. And my speaker can be in front, it can be to the side, but it can also be behind. So it has become necessary to bring the outside world into our studios, inside our studios, so that we can keep our finger on the pulse. As I said before, I cannot just rely on the subjective impression of my patient who tells me that he went to the theater with his wife and had difficulty understanding. I need to be able to reproduce it as much as possible, reproduce it using a wonderful tool made by you, the Symphonia, which allows us to place the patient at the center of a sound simulator. In addition, we use REM to measure what is happening at that moment. Let me give you an example. How often does a grandfather say, when I pick up my grandson from school, I can't hear him because he's behind me? How can I tell if this is true or false? I use REM and simulate the situation itself. Because as I said before, if I am not sure I can give him the ability to hear, how can I expect him to hear at a time when he is not only focused on hearing, but also performing other functions? This goes back a little to what I said earlier, because the patient is at the center. It is up to us to adapt our tools to respond to our patient.
And so, through this 360-degree live speech produced by the Symphonia system, you essentially create a sound field, which is what the patient will then hear when they walk out their front door.
Exactly.
For my grandmother, they recreated the church environment with the priest speaking and everything, and from there on, she was immediately convinced, because in fact, you have to convince them.
But actually, that's just it. Many times we work hard to provide very good audibility, a comfortable and clear voice. However, maybe for our patient, that's not what's important. I remember a teacher who, even though we had done an excellent fitting and she could hear everything well, struggled to hear the school bell Once we solved the issue with the bell, her satisfaction was completely transformed.
And this is thanks to live speech. So real ear measurement, in vivo measurement, speech, intelligibility index, and 360-degree in live speech. 3 tools that you at Pontoni can no longer do without. Who knows what will happen in the future? And so I would say, let's take a look at a future that is actually something we hear about every day, because we are increasingly surrounded by smarter prostheses, there are automatic algorithms, and there is constant talk everywhere and in every context of artificial intelligence applied to fitting and diagnostics. Now, is this a great opportunity? Certainly, I would say, but I also see it as a bit of a challenge probably for your profession. And so, returning to the subject of young hearing aid specialists, I wonder, could these young people think, will the prosthesis do everything? Will the software do everything? Why do I need to study? Why do I need to learn new methods? I therefore ask you if you have ever perceived this danger, this sort of total delegation to an increasingly powerful technology?
Should I go?
Go ahead.
In my opinion, no. Perhaps I am mistaken and we will see a different future. But all you need to do is spend a few days interning at a hearing center. Unfortunately, we are in a sector where we will never have 100% satisfaction from our patients. On the one hand, they would like to hear again, as they did when they were 20. But on the other hand, we who are in the business, even in restaurants, find that there are certain situations where we also have difficulty hearing. And unfortunately, people who have hearing problems, despite all the counseling we can do, always blame their hearing aids in those situations. We deal with people who every day, at every checkup, ask us for something more. I couldn't hear well at the restaurant. I couldn't hear my neighbor whispering to me in church. There are always requests. And if, from a technological point of view, we hearing aid specialists see that they are miracles, what we are seeing through hearing aids, through instruments, etc., from the patient's point of view, in my opinion, we are still far from having perfect hearing. And so there is and always will be a need. Always perhaps a big word in reality, but there is a need for the hearing aid specialist. There is a need to roll up your sleeves and work with the patient. So I don't think that the trainee, the young hearing aid specialist, can think, I have nothing to do.
On this point, I would like to add that sometimes patients from other clinics come to us, sometimes with the best possible prosthetic solution. But even the best technology, if not managed and guided correctly, does not lead to the desired results. I'm not going to look for difficult things now, but simply the correct application, which is the correct coil, as Francesco said earlier, compared to his father. The coil is still a fundamental aspect, so if the carlona is made, the result will not be achieved. Therefore, the hand of the hearing aid specialist is still very important compared to the artificial intelligence that is talked about so much, compared to all these automatic prostheses. All technology must be guided and managed by a professional.
Perfect. So, Marina, you're telling me that basically, if hearing aids become increasingly automatic, if artificial intelligence becomes more and more sophisticated, the role of the audiologist will still be absolutely essential. However, and this is where I want to ask you, you'll probably need to be even more skilled, with even sharper critical thinking, and therefore an even more methodical approach, precisely in order to master this new technology.
As you rightly said, we must always expand our skills because it is a more powerful, more precise tool that we have at our disposal, but it requires that we also know how to control it. Every automatic feature we include in a fitting can be an advantage, but it can also be a potential disadvantage. I need to understand, based on my patient's needs, which of these automatic features we should use and which we should not. Above all, this leads us to acquire many cross-disciplinary skills that go beyond our field of work. Every day, I find myself wasting a lot of time with patients' mobile phones, something that seemed like science fiction a few years ago. Now that hearing aids are connected and have apps, most of the time it's my hearing aids won't connect to my phone, but I didn't study mobile phone software in audiology.
Sure. So how do you handle situations like this?
You need to acquire new skills.
You have to acquire new skills, and I would even say pass them on to young hearing aid specialists.
But in this case, it's the young hearing aid specialists who share their expertise with us because When we can't figure things out, it's often the intern who helps us with these issues related to cell phones.
I'm also thinking about our experience, yours and mine, Marina, but also considering Roberto. We started working in this field in 2007, and maybe not every year, but as time has gone on, we've had to study more and more. So this is something our field has demanded of us. You can't just stop. You can't enter this world and stay put. It's required. We need to have more skills. And I see that this need hasn't decreased over time. It's actually increased. More equipment, more technologies, more manufacturers.
And who knows indeed where we will end up. Therefore, you as hearing aid specialists, professionals in your field, I believe you also have important responsibilities, including in fact as educators for these young people, precisely to prevent hearing aid fitting from becoming in their eyes, who already find all this technology ready-made, just a matter of click and apply, because it's easy for everything to end up like that.
I think that our job, and in this case I can say ours, because I talk to 40 hearing aid users every day. Marina is our technical manager, so who more than us, in my opinion, we have to teach them to think. This is the most important thing, that is, if they understand that there must be reasoning behind it, then everything becomes easier. It is no coincidence, for example, that we work with all manufacturers, but we also do so to ensure that they are always open-minded. They need to explore, they need to understand more, they need to understand that when they are faced with a patient, a person with their own problems and needs, they need to know that every manufacturer has its pros and cons. And it is up to them to think critically, to reason in order to find the best solution. If this part is missing, then we can be replaced by machines, etc. In other words, there must be reasoning behind it. So I think this is the biggest job that Marina and I do every day.
Do you agree?
I completely agree, because there is no such thing as a finished job, even today. And in fact, in my opinion, one of the most valuable aspects of our Clarivox protocol is precisely this. There are certain stages where you have to stop for a moment to think and consider the right path to take, because the job is done doesn't get you anywhere these days. For one simple reason, we work with people and every person is different. So we have to stop and think about the solution that is right for that person, not a generic solution.
Absolutely. Every person is different, every hearing is different, and the difference will be made by the hearing aid specialist who will apply their methods to that person with that ear canal and those problems. We have been on a journey, I would say, a journey that started in a laboratory created by Mr. Roberto in 1989 and has led us to today's challenge of artificial intelligence. We talked to Francesco and Marina about technology and listening, about objective measurements such as REM and the Speech Intelligibility Index, but we also talked about relationships, voices, and something very important, which is professional responsibility towards the patient. Now, Marina and Francesco, I thank you very much, because you have reminded us that a hearing aid is not just a device, it is not just a piece of equipment, but a method, a comprehensive method. Therefore, an algorithm is not enough if the clinical perspective is missing. Returning to artificial intelligence, no artificial intelligence can replace the act of caring for a person with great rigor and, of course, infinite empathy. Empathy that, in my opinion, is often lacking in the clinical setting. A personal curiosity, is there a sound that you love and that reminds you every time you hear it while you do your job? A somewhat sentimental question.
Well, as far as I'm concerned, it's not exactly a sound, but a person with hearing loss is often a bit isolated, a bit withdrawn, a bit absent. The moment they hear, you can see their eyes light up. That's what I look for to understand. Okay, I've done a good job.
So the look in their eyes, Francesco?
I thought about it for a moment while Marina was speaking, because it's quite a difficult question for me, because I'm teased a bit internally, because they see me a bit like a robot in the sense that I'm very rational, I think in a certain way, etc. This is a slightly more sentimental question, if you like, but in reality, there is a sound, the beginning of the background noise of the matrix test takes me, in my opinion, to another dimension, where I start to say, okay, let's see what the results are after all the work I've done. So, in my opinion, that sound catapults me into another reality.
The initial noise of the matrix test, I never expected that answer. Well, I don't know how to thank you. It was truly a wonderful conversation. And also to those who are listening, thank you so much for being with us. If you like, please share this episode and pass it on to your colleagues, students, and patients. I would say that talking about hearing means talking about life, real life. Thank you all. Thank you, Francesco. Thank you, Marina. And maybe we'll do another episode together.
Thank you, Anna. See you soon.
Thank you.
See you next time.